Hi, I'm the Dr. Rashathon Panchapratip from Bangkok, Thailand. Today I'm going to talk to you about a needle-free laser pressure microjet delivery technology for hair regeneration. Androgenetic alopecia is the most common cause of hair loss. The frequency and severity has been shown to increase with age. The report prevalence of baldness in Asia, especially in Thailand, is roughly about 40%. Here is the summary of the androgenetic alopecia treatment. We all know that the established medical treatment for AGA, including 5-alpha reductase inhibitors such as finasteride and dutasteride, topical and oral minoxidil. The second is emerging medical treatment. There are many emerging medical treatments that going to be studied and to be approved for the treatment of AGA in the couple years. The procedural treatment including laser and light therapy, regenerative medicines such as platelet-rich plasma, exosomes, tissue micrograft treatment, mesotherapy, scalp threading, botulinum toxin microneedling, and at the end of the stage, hair transplantation can be used to treat severe androgenetic alopecia as well. Here is a list of emerging medical treatment for AGA that are ongoing study in the clinical trial phase 2 and phase 3, including long-acting minoxidil, sublingual minoxidil, mTOR inhibitors, PP405, as well as clascoterone. Today we will focus on the mesotherapy for androgenetic alopecia. Here's the list of injectables, including PRP, dutasteride and bicalutamide and minoxidil, cell-free therapy, cell therapy, botulinum toxin, exosomes, and others, melatonin or vitamins can be injected to the scalp and improve the hair regeneration. In general, injectable treatment for hair loss has shown to be less effective than the oral FDA-approved medication, but they target approach to the most affected area, so there are less chance to develop the side effects, and also the longer effect at the injectables area, so the longer time of interval between sessions compared to the topical treatment. The limitation of the conventional intradermal needle injection, of course, including pain and the people who are afraid of needles. Multiple puncture can cause bruising, infection, and even drug distribution in particular case. Also, variable injection depths depend on the injectors. So that is why the technology of the Mirajet has been developed to overcome this problem or the side effect of injectables. So what is a microjet? It is generated by an expansion of vapor bubbles induced by the focused laser beam of the erbium yak 2940 nanometer lasers. For the principles, the laser induced vapor bubbles expansions, and then they produce a high pressure microjet penetrate into the stratum corneum and into the skin. So the target layer is roughly at the papillary dermis or follicular regions, which is approximately 300 micron from the epidermis of the skin. So it can impact minimal epidermal disruption, which is very good for the drug delivery system. Again, these photos show delivery mechanisms starting by erbium yak lasers. They pass through the upper chamber of water and then make the water become a bubbles, and then they push the medication in the syringe go through the skin. Here is a histopathology study that showed the microjet in the skin at the level of roughly about 300 microns, which is at the level of the papillary dermis or the follicular regions or infundibulum part of the hair follicles. To me, actually, microjet or Mirajet is different from mesotherapy. It's not kind of similar to the technology that we call the MMP. MMP is a micro infusion of the drug into the skin. The MMP techniques aim to promote the drug delivery in the epidermis and superficial dermis. At the original, the MMP used two machine with the needles and mixed with the infusion drug, and they pushed into the skin. So the benefit of MMP is not creating a mass effect, which is reduce the chance of localized adverse event. With the MMP, you can adjust the drug delivery and infusion depth so they can increase the safety of the technique or the safety of the medication that has been used for the scalp and the skin. With the microjet, you can use with many type of solution that hydrophilics, and the size should be less than 250 microns, including PRP, vitamin, glucose, hyaluronic acid, botulinum toxin, PN, PDRN, PDLA, or all the biostimulators can use with the various indication, both in the skin and for the hair follicles. However, there are some concerns about the drug stability because they have a heat and shearing force inside that might degrade the thermolabile or shear-sensitive compounds. So be careful in these agents. And also related to the volume constraint, the microbolus require multiple pulses for the full dose delivery to produce a significant amount of the medication in the particular area. For the technique of the microjet, there are two modes that can be used for the skin. The first one that we call the stacking mode, that 10 shots of the microjet has been pushed down per one point. So you can see the small bubbles into the skin like this. The second mode is the moving mode, that your handpiece has been moving around the skin without stopping. So the skin become like red, a little bit slightly red after the treatment. This is called the moving mode. Roughly 50 shots was created per one area. So at this moment, the microjet has been proved the efficacy for the skin rejuvenation and many dermatologic conditions. This is an example of the publication that using the microjet with the PLA and HA filler for the skin rejuvenation, and the study showed with the microjet technology show the faster and significant gain in the skin hydration and elasticity just only 4 weeks from the injectables. This is another study that used microjet with PDLA for the stria distensa. You can see the improve in the stria after the injectable at 2 months. This is also another report of using PDLA with the microjet for the stria distensa. The treatment has been shown to perform in 1 to 2 sessions per month, and you can see improvement with the high certifications after the treatment. This is another laser using PDLA with the microjet with the enlarged pore. And this is another one that interested that using the microjet with PDLA for the atrophic acne scar. The treatment has been done only 5 sessions over 2 to 5 months, and you can see significant improvement in the atrophic acne scar in the temporal area. This is another interesting study that compared the injectables botulinum toxins with normal injection compared to another size that using the microjet injection. And the study showed both methods can improve the curl frizz and wrinkle in the equal efficacy. So it's interesting that we can improve the wrinkle without injection. Another one is using the PDLA with Microjet for the rosacea and also for the pigmentation problem like melasma. And this is the Microjet with PDLA for the photoaging. That's all show that the Microjet can produce the lightening and improve the photoaging pigmentations from the photos. Let's go to the application of Microjet for hair regrowth. Here is the parameter of the Microjet I used for the scalp in the androgenetic alopecia patients with the exosome growth factor and liquid dutasteride. I used the Microjet Delivery at 4 mm spot size, 4.8 joule per square centimeter of erbium yak in the FSP mode at 15 to 20 Hz, and we use a new linear threading technique that you will be seen in the video at 45 to 90-degree angles to the skin. The end point is you have to develop wheal formation with minimal pinpoint bleeding. The pain score for the patient is roughly about 2 to 6 out of 10. It's not going to be totally no pain, but it's usually tolerable. The precaution including standard aseptic techniques, including the hand hygiene, glove, antiseptic combs. Here's I'm gonna show the video how I do it. So the indication is used to the mild to moderate androgenetic alopecia, or you can use in the scarring alopecia as well as for the senile alopecia. This is for the Microjet testing, and this is a pre-prep medication. You have to test first with the normal saline to check that the nozzles is work properly. As you can see the Microjet coming out. Here you can see that it's not come in the drop, but it's come in the linear jet. It is roughly about 10 seconds that we have to test. Then you can switch from normal saline to the drug solution. Here is a new linear threading technique that I use. As you can see, it's developed the white blanch of the skin with minimal pinpoint bleeding. Here is example of the patient's 50 years old male using the dutasteride powder mixed with normal salines and treated with the Microjet technologies at 1 month interval for 3 sessions. You can see the big improvement on the scalp, especially in the crown area. And here is another example of the patients. You can see before and after of Microjet treated with the PDLA at 1 month interval for a totally 6 treatment sessions. You can see big improvement of the hair loss in the crown area. So in conclusion, the Microjet is generated by the expansion of vapor bubbles induced by the erbium yak technologies. I am also the fan of photon laser, so if you already have photon laser, you can just only have the Microjet handpiece. You can develop another treatment for the patients. So it is an ideal trans-epidermal drug delivery system to the levels at the papillary dermis of the skin and around the infundibulum part of the hair follicles with minimal epidermal damage. So this is a novel needle-free drug injector to stimulate the hair growth. However, they need more clinical and histopathology study to show the efficacy of this in the hair field. So thank you so much for your attention.